got when?
Go.
Is it on?
Yeah. Yeah.
Hey, caught me in the gym. I'm pumped. It's What's New Wednesday at Dominion Fertility. We practice what we preach. Excellence. And excellence means performance, and that's what we want. We want babies. We want everybody who comes to see us as patients to be pregnant. So I'm pumped today. I'm going to lead the charge on exercise and your fertility. Or, as some famous musician said, baby, we are born to run. Ha! Well, he knew what he was talking about. Of course, you know we're talking about Bruce Springsteen. Actually, I'm grooving on Dave Matthews right now, but I'm going to take this aside for a second. And, you know, I know Bruce wasn't talking about fertility when he said, baby, we were born to run, but it's an important area of medicine, and I don't think it gets enough attention, your reproductive health. So we're going to talk about this today, and hopefully I'll help you out with that. So, you know, obviously I believe in exercise. I wouldn't be here, number one. Number two, I'm not going to tell you to do something I don't do. So we want you to exercise. But you're going to find some interesting stuff that I actually, when I was researching some of this, didn't know. The American College of Sports Medicine says that up to 44% of women who exercise can have problems with their menstrual periods. Either they stop altogether or they're irregular. And in runners, it's about 24%. That's a lot of women. And so, you know, it begs the question, is exercise good? Well, I think so. And the Nurses' Health Study from the NIH says that exercise is a boon for your fertility. So I advise my patients and discuss, you know, do they exercise? And, you know, the question is exercise good or bad based upon what I just told you? Well, exercise is good. Obviously, being a couch potato or sitting on the couch and being sedentary, I don't think that's such a good idea. But too much exercise can have some problems of its own. So what do you do? Well, the key is smart exercise. And, you know, I'm no Chippendale or eye candy anymore, and I'm not a personal trainer, but physical fitness is important. And there's no magic formula or secret to any of this. It's just some good common sense. Like, I go to the gym 3 to 5 times a week. I like 2 days off. And exercise, you know, for about an hour, hour and a half. And what you need is to get your heart going. And this is one method, the elliptical trainer. Perhaps you like the bicycle, the Stairmaster. You might like to run, you might like to swim. It's all good. So the key is to get your heart going for 30 to 60 minutes, 3 to 5 times a week. It's all good. And if you're a newbie, that's fine. It's never too late. Never, never, never too late to start exercising. You might belong to a gym, talk to a personal trainer, or you could do this yourself at home. On the internet now, you can always find workout tapes and stuff like that. So I think exercise is a good thing. It helps people, makes them feel better, better sense of well-being. I think I perform better. I have a really long day. I start at 7, walk out of here sometimes 5, 6 o'clock. Pretty action-packed day. And quite frankly, at my age, I couldn't do it unless I did this. But the bottom line, it helps you in your ability to get pregnant. Well, can too much exercise be harmful? Yeah, there's problems if you don't exercise, there's problems if you exercise too much. So like I say, 3 to 5 times a week, getting your heart rate up for 30 to 60 minutes is a great idea. You can also throw in some stretching, I like that, and some very low-level weight strengthening too. You don't want to hurt yourself. But too much exercise can be a problem. For example, marathon runners. When I see patients who run marathons, I got to throttle them back. Now, why is that? Because almost always, if you run more than 20 miles a week, you'll have problems with your menstruation. It'll either become absent or irregular. And even if it stays regular, most people who run more than 20 miles per week can have problems with their luteal phase of their menstrual cycles. And long term, it can cause real problems because when you exercise, it's physical stress. This is good. Your catecholamines and your cortisol levels go up, and that can have an effect on your GnRH regulator, shutting down your FSH and LH, which are the hormones that stimulate your ovaries to produce estrogen. That's not good. So we're all for exercise, but 3 to 5 times per week, cardiovascular, 30 to 60 minutes at a time, plenty. And if you're just starting, start slow. Cardiovascular for 10 or 15 minutes, and then build up. What about your BMI? Okay, according to the government, I'm fat. My BMI is 25, almost 26, can you believe it? When I got that number, I almost died. You know what, I don't care. As I tell patients, I don't treat numbers, I treat patients. And I feel good, and I think I'm okay for an old guy. But the ideal number for BMI is between 20 and 24. So, yeah, sure, that's a good number, but when do we get worried? If it's 16 or less, then you may be underweight. And that too can cause problems with ovulation. And if you're over 30, then that's excessive. And that can cause problems when you don't ovulate too. Both those things will affect your fertility, of course. So we like to talk to people about, their exercise and also their weight. But if you're overweight, it's been shown through many studies that simply reducing your weight, a lot of times you can get pregnant just by doing that if you're not ovulating. It'll decrease pregnancy complications, and the clinical outcomes are always better. All right, I've laid off, but now I'm going to go after the guys, the men. You too need to go to the gym. Ladies, take those guys in the gym with you. All right, so it turns out guys who are overweight, may not be as fertile or as healthy as their counterparts. And what do I mean by that? Well, excess weight causes testosterone levels to go down. And when that goes down, your energy levels go down, and your libido goes down. But also, low testosterone can affect the sperm cells. So, we can't have the guys being couch potatoes while the ladies are in the gym. They got to jump in on this too. And it's really important. I call all this planning for pregnancy. And there are a lot of studies that say this is important. And, we need to do this. But, living in DC, stressful area, right? And exercising will help reduce your stress. So Dr. D, how do I do all this? Now I work just like you, long hours, you're telling me I gotta eat better, I gotta sleep more, I gotta exercise. You're right. I didn't say it was easy, but we need to do this. It's really important. Some other things I'll just mention briefly, and that is acupuncture helps with stress reduction. Supplements. I'm not a big fan of supplements. I think most people in Washington eat well. I take vitamins, okay? Just a general multivitamin. And turmeric, I take that. In infertility patients, some of them I tell them to take CoQ10, no problem with that. If their ovarian reserve is low, some DHA. So I think that, this baby we were born to run, I think there's something to it. Now I know Bruce had a completely different attitude of what he was talking about. It wasn't about infertility patients. But for getting pregnant and a long life, I think it's almost a perfect model. And when I go to the gym, by the way, I'm always plugged in and I get in a rhythm and I actually like it, It's not weird. You can like it too. So nutrition, exercise, sleep, and let's get a baby for you at Dominion Fertility. Any questions?
Yes, Jono is wondering, do we have a cutoff for BMI at Dominion Fertility?
Well, remember, we don't treat numbers, we treat patients. And so most of the people we can work with, it's very, very rare that there's a BMI that's too high or too low, and we can't work with you. I will tell you, I saw a patient yesterday. She came to me a year ago, and she weighed 340 pounds, and she was 28 years old. And I said, I'm not going to charge you for today's consultation. I said, let's have a talk. And I just simply advised her, you've got to get your health for yourself, back where it needs to be before we start talking about a baby. She came back a year later. I didn't even recognize her. She says, Dr. D, I saw you a year ago. I go, you did? She said, yeah. I weighed 110 pounds less now than I did a year ago. Now I said to her, let's make a baby. So we don't have absolute cutoffs. It's a good question.
How about the day of retrieval? Do you ever recommend rest days during their cycle?
Rest days?
Yeah, where they do not have exercise.
Yeah, because when we do stimulated IVF, a normal ovary is about the size of an egg out of your refrigerator. And when we stimulate them, they could be as large as grapefruits. So it's uncomfortable. So I wouldn't tell somebody to exercise. You know, exercising can be anything. Just because I'm on this elliptical doesn't mean that's the only method. I like to dance. And I tell people, if you're not sweating, you're not dancing. So maybe you don't like the gym. Maybe you don't like this. Go out and swing dance. I'll see you on the dance floor. Any other questions?
Not for now, but they said you got a lot of likes and they love that you recommend balance being the key.
Well, I think that's important in life, balance. And you know, if I didn't believe in this, then I wouldn't feel I would be the right person to stand here today on this elliptical and tell you to do it. So trust me, I think I benefit from this, and I think you can too.
Well, thank you, Dr. D. This has been a great What's New Wednesday.
Well,
I know I'm going to turn off the camera, but you will probably keep going for another 30 minutes.
I had Dave Matthews on. I'm going right back to where I started. Thanks, Annie.
Go on, Dr. D. You're the best.